Release of Tethered Cord. Introduction. The spinal cord connects the brain to the rest of the body.
Select true or false.
Correct. The spinal cord sends orders from the brain to the arms and legs. It also brings back to the brain sensations and other information from the rest of the body. The spinal cord always extends to the last lumbar vertebra.
Select true or false.
Correct. The spinal cord usually ends at the level of the second lumbar vertebra. A tethered spinal cord does not always show signs or symptoms.
Select true or false.
Correct. Some people who have a tethered cord do not show the signs until late in life, if ever. This may be true even though the condition occurs shortly after birth. A tethered cord always involves some type of tumor.
Select true or false.
Correct. Benign fatty tumors or simple thickening of the phalum terminale could be associated with this type of malformation. However, not all tethered cords are associated with tumors. Physical therapy can cure a tethered cord.
Select true or false.
Correct. Only surgery can help prevent any further damage caused by the tethering. Physical therapy may be needed later to help improve the patient's strength. The surgeon always takes the whole tumor out.
Select true or false.
Correct. Using his or her judgment, the surgeon will take out as much of the tumor as is deemed safe. Some tumor may be left behind if the surgeon determines that removing it will result in more spinal cord damage. Fatty tumors are not malignant and therefore not likely to grow significantly over time. Are strokes and heart attacks common during and after this operation?
Select yes or no.
Correct. Anesthesia is now very safe. However, the older you are and the more medical problems you have, the higher the risks. You should make your anesthesiologist aware of any medical problems you have had in the past, such as strokes and lung problems. Are infections very common after the surgery?
Select yes or no.
Correct. Infections are very rare. Though rarer, infections as well as bleeding and scarring may occur. Paralysis is common after tethered cord surgery.
Select true or false.
Correct. Paralysis is not common after tethered cord surgery. However, paralysis, bleeding, and even death do rarely occur, especially if the patient had symptoms of paralysis prior to the surgery. A CSF leak is always temporary.
Select true or false.
Correct. If CSF leaks, another operation may be necessary to stop the leak. Thank you for using Explain.